Are you guys back in Santa Monica with Dr. Rand? This is Ask the Doc, and we have a slew of new questions for you guys this month.
A slew.
A slew, yeah, a bunch. Doc, how's it going?
Great.
It's good?
Yep. Enjoyed a
Yeah,
great lunch with you, and happy you're back in town.
I know. So,
Happy
all
to have some
right.
good questions. Looks like this week there's some more from the ladies. Thank
More
goodness.
females this week,
Yeah.
yeah, so which you like. I know you like that. So, I'm going to let you go ahead and start with question number one.
All right. So the first one says, discuss how normal range hormone levels have declined over the past several generations, and what true baseline levels should be. So this is an interesting question because it begs the question: where do they get these ranges from to begin with? If you look at, for example, cholesterol numbers, right? The LDL, the so-called bad cholesterol. I won't go into that one again, but when I first started in medicine, I believe the level was acceptable. The reference interval was below 160. And then somewhere in there over the years, that level dropped to an acceptable level of below 130. And now, I think probably as of the last 5 years, it shows that the acceptable range is, and by the way, acceptable, what does that mean? I'll come back to that in a second, but the reference interval they're showing is less than 100. Well, I've been practicing long enough to see that if that's normal, as the question asks, they're supposed to be normal, it's not. Because that sure as heck isn't what I've been seeing over the years as normal. That's not what people are coming in with. I don't care, and I joke with patients all the time. If you're getting chased by lions on the Serengeti Plain on a daily basis, maybe you'll get it down to below 100, your LDL cholesterol, but certain diets can effectuate that. But I've also seen plenty of healthy, very healthy people who've adopted a ketogenic diet, and it works for them, but it's typically anti-inflammatory, okay, that particular diet, and they had squeaky clean arteries. And I'm not guessing. We've gone ahead and done the various testing, whether it's a bilateral carotid Doppler ultrasound or the whole enchilada, coronary CT angiogram with and without contrast, and yet they've been eating all these saturated fats, and their LDL cholesterol could be over 300. And so that's just one example of how normal ranges aren't necessarily normal ranges. Again, I don't know where they're getting a lot of these reference intervals. And when it comes to hormone levels, ditto. If you look at testosterone for a male, for example, you'll see a range that, again, when I started practice, it was somewhere around, depending upon the laboratory, 200 nanograms per milliliter of serum testosterone to an upper limit of 1,200. Well, that's a huge range. That catches everybody. Mm-hmm. Now you could argue, okay, well that's a good reference range then, but why do we need that then? What does it mean? Why is it included on there if it's a catch-all for everybody? So you fit in with everybody. Okay, I guess you could argue that has some value, because if you're below that or above that, then you're the odd man out, and there's something to talk about there, something to address. Nowadays, they look to have adjusted those according to age, although you'll still see, for example, really all they've done for, say, a male in his 40s is pared down the upper limit to somewhere in the low 900s, again, depending upon the laboratory, and still the bottom number is somewhere about the same in the 200s, right? Well, again, it's such a broad stroke. What real value is that giving you in looking to these numbers to help you figure out what's going on with the patient? Not much. And then if you look at the normal range of serum testosterone compared to free testosterone, where you're talking about the free will be somewhere for a male again, I want to say somewhere around 8 is the bottom, and then the upper limit, depending upon the age now, again, let's call it a 4-year-old male, will probably be somewhere around low 20s in picograms per milliliter. Again, a broad range, but if you look at the two combined, you go, wait a minute, it's not commensurate. There's an overlap there that, it's not parallel. I don't know if there's probably a good statistical word for it that's not coming to mind right now, but they don't match up. Mm-hmm. And they should match up. In general, again, free T should be about 2% of total T, and this gets into a whole nother subject when you look at different labs. Like They've moved the decimal 1 point when you look at, say, a Quest lab in that regard, but that's a whole other story. Anyway, in getting to answer the question here about the levels, the question asked about what true baseline levels should be. That really begs a whole other question. Is there such a thing as what it should be? Mm-hmm. Fortunately, Dr. Abraham Morgenthaler came out at one point and said, this idea that total testosterone, again, for a male should be over 450, otherwise it's considered hypogonadal and should be treated. And I think it was part of that international consensus I've mentioned before that was published in the Mayo Clinical Proceedings in 2016. That goes out the window. There is no number, okay? And there's all kinds of problems that come up with a number rather than even a range. Mm-hmm. But even then, that's a number on either side, and if you're one below that, what does that mean?
Right.
And especially given that these hormones, all these numbers are going to fluctuate to some degree, some larger than others, depending upon where you grab them. They should be general guidelines, is what I think we are all beginning to agree upon now, right? That would make a case for broad stroking it again, because they should be general guidelines, and this is capture everyone. I guess really where I'm leading with this is getting to the utility of these numbers to begin with. They're really just sort of general observations is what they should be, I would say, of what we see out there, because there's so many cases where they certainly do not reflect optimum. And for example, going back to the cholesterol, where are they getting that number from? Because that's not what we see in the population, okay? So that must be someone's or some group's decision about what they believe is optimum. And yet some of these other hormones, some of these other panels that are hormone panels, for example, appear to simply be an observation of, okay, this is what we see on the low end, and this is what we see on the high end. I'm not sure, and I've spoken to, Dr. Holmquist over at Esoterics Labs at length about some of these, and sometimes it's a very humorous conversation about where we come up with these numbers and how we test for them is a whole other subject. But it begs the question about the utility of these numbers again. What value are they if they're not something that you're striving for, if they're just an observation, which, normal, I joke all the time, it's normal to get sick and die one day. So do we want to really compare ourselves to normal all that often, and to what degree? So I can't answer the question of, they've declined over the past several generations. Hormones, we're talking about a lot of different hormones. I'm not sure that's the truth. I think the thyroid levels that are presented as the normal reference have stayed the same. I think maybe they're referring to testosterone here, and that has changed the way I described. I think that they've backed down on the upper end of the reference interval based upon age, because we're going to produce less and less as we get older. So I really can't comment more than I have blathered on here about it, just to simply make observations here, because I'm not quite sure, and I've been a physician for a while, where they get a lot of these reference intervals. So I would use them as a general guideline to determine aberrations, although again, I bring up the fact that aberrations from what? If they're simply observations of what we see, and it's a 95% confidence interval, so you're dealing with a section, broad section of the population that gives you a general idea where you stand compared to everyone else, but that might not be a good thing.
Yeah.
Per my suggestion about, normal is oftentimes pretty poor.
Yeah.
Another example is, for example, fasted insulin levels, okay? I think the range goes from something like 2.6, let's say, to 22 or 24 or something on the upper end in a LabCorp assay. And you do not want to be on the upper end of that. It is probably very normal. That's one that's probably just observing the lower end and the upper end and that confidence interval and saying, this is what we observe from all the patients that come see us. But when you think about, possibly a third of these individuals have undiagnosed or diagnosed fatty liver and or diabetes, well, do you want to be part of that upper end? No. You want to be part of the lower end typically. But we saved ours.
Yes, we did.
All right.
All right. Y'all good. Y'all good to go.
Number 2.
Number 2.
All right. Number 2 says the importance of TRT for women and its impact to overall health and well-being, not just for bodybuilders. Thank you, Dr. Rand. Kim B. So I guess just discussion of this is what's being asked. Boy, that's a loaded question in the sense that, yeah, it's important just like it is for males, I guess maybe that's the question, is male and female. It's equally important for a female as it is a male. When it comes to overall health and well-being, the same deficiencies, the same complaints from hypogonadism, meaning ovaries that aren't functioning like they should be or like they were originally in your youth, just like the gonads with male, the testicles are not functioning as well. This testosterone is responsible for your energy, typically, or contributes your just general feeling of well-being. That joie de vivre, as the French say, and I like to say, it's responsible for supporting your libido. It's nature's antidepressant. People complain when their testosterone is low of brain fog, which I liken to, not a problem with the filament in the bulb, but just not enough energy going to the bulb, so it flickers, and so it feels that way maybe with what people are describing with brain fog. But there's so many things that testosterone is responsible for that, again, cross the genders. It's really the same, just different amounts of testosterone, which you could argue makes sense for a myriad of reasons. But one thing I didn't mention, body composition. Testosterone supports your muscles. It supports your production of red blood cells too. Not that it alone will bump up the production of red blood cells, hemoglobin, and hematocrit like so many claim. It will leverage that though, but certainly without enough, you can become anemic, and I've seen that many times. But it doesn't create it, and I think we've talked about that in prior episodes of the show here. So it's just as important to a male, or to a female, as a male. And while bodybuilders are certainly concerned about the latter part of what I said, muscle building, it's not exclusive to that. So that's pretty concise for me. So I'll stop. I can't really add to that.
Awesome. Thanks, Doc.
So this is from Quinn Riley, who says, "Hey man, I'm 15 and thinking of taking Anadrol for 2 weeks at low doses, as well as taking liver health pills to decrease side effects. If you could give me your advice, I'd appreciate it a lot, man." Well, here's my advice, like it or not. You asked for it. First of all, let's just pretend you're not 15 years old for a second, and I'll tell you that taking Anadrol for 2 weeks at any dose is not going to do you any good anyway. We know that with these anabolic steroids or even bioidenticals, that it takes a certain amount of time for those hormones to, as we say, kick in. Typically, it's about 6 weeks. Some would argue with oral anabolics that it might be as soon as 4 weeks. And of course, there's differences individually as to when that happens. But there's so many things with this question that I like to address, but I don't want to belabor it. At 15 years old, I'm not sure the reasons for your deciding that you want to take Anadrol, but typically Anadrol is used for what we would refer to as mass building, although in Western medicine it's indicated for anemia. Again, not enough red blood cells or hemoglobin. So if that's the reason, that's one way to treat it. There are plenty of other ways to treat anemia, though, before you went to Anadrol. But if it's simply because, like so many people who take Anadrol, you want to put on the muscle mass. And by the way, it's not typically just lean muscle mass. There's a lot of water that's associated with taking Anadrol, because even though it cannot convert to estrogen, we believe that it somehow, and we don't know, but we believe that it might activate the estrogen receptor anyway, and can lead to some moodiness and irascibility that can be associated with excess estrogen. But anyway, you're not necessarily going to accrete lean mass like you will with another anabolic steroid, like another DHT derivative, Winstrol or Anavar, stanozolol or oxandrolone, respectively. But at 15 years old, you shouldn't expect to be, jacked, yoked, whatever you want to call it, that muscular yet. You're still too young. I'm not saying don't try and that you can't be more yoked than a typical 15-year-old. Not saying that at all, but there's a certain amount of, wiring, soft wiring that still hasn't occurred yet when it comes to your hormones in the hypothalamic pituitary adrenal axis. And not only that, you don't want to mess with them while they're still forming, which technically is still until you're about age 26. So if you introduce something to stop that development, which this could do, or mess with that development, not necessarily stop it, then you might be creating something that will last for a long time and that might not reverse. That said, I will be completely candid and say that doesn't happen that often, but who cares? You don't want to be the one it happens to. So maybe consider some other things to do instead of Anadrol. Again, I'm assuming that the reason for this is to create muscle mass. Now, if you're 15 years old and you have super low testosterone, which you don't state here, but I guess I'm going to riff a little bit. Before I took anything, I'd want to consider an MRI of the head to see if there's an issue with the pituitary gland, maybe a microadenoma or what we call an emptycella, before you do anything. And there are other ways of bumping up your natural production of testosterone and therefore creating muscle mass, et cetera, and getting all the benefits that don't involve what would amount to possibly interrupting development of your HPA axis and decreasing your endogenous production of testosterone, probably not for a lifetime, but certainly for a short period, which might completely reverse the things you're trying to do with the Anadrol. So, and again, just sort of as a side note, taking something, liver health pills, I don't know what that means, but typically these oral anabolic steroids are mislabeled as something that damages the liver, at least to the degree that's talked about, because people look at AST and ALT assays as being liver enzymes only, and yet we know that those enzymes can also be released into the bloodstream if there's muscle tissue damage or turnover, because you're a more well-muscled athlete at some point, or well-muscled individual, period. So that if someone is taking an anabolic steroid, you probably are going to find an elevation, typically ALT, but also AST. Either one can be elevated, or they can both be elevated together because you have more muscle mass. And I think this has been attributed, this elevation, to just the fact that somehow these oral anabolic steroids are negatively affecting the liver. Now, there are some that are worse than others because there's a certain ligand, excuse me, that might be attached, and typically for the purpose of, like methylated testosterone, to keep the liver from breaking it down too quickly. So it stays in your system longer, and that does tax the liver. But I think it's much, much more overblown than it really is. And that's one of the reasons for obtaining a GGT assay when you do your blood draw for different labs, because that's specific to organ tissue. It wouldn't be elevated because of muscle tissue breakdown, in other words. So you can correlate, or you can use the two together to determine, okay, well, is this indeed most likely liver or not, using those two to differentiate. But a liver health pill, the typical problem that you may run into, not so much these days with the way we've developed our exercise IQ, as opposed to before, where guys who were trying to put on muscle would do a heavy set, then rest for a long time, like 5 minutes or more, do another heavy set, spend a lot of time in the gym but not really get a whole lot of volume in there, except in terms of heavy weight, to bump up the numbers a little bit. But then a lot of eating and a lot of resting all day. So a lot of guys would develop, with the help of the anabolic steroid, a fatty liver. That's where you risk, toxicity to the liver, and that's where things like, back in the day it was choline and inositol were used to clean fat out of the liver. Now we add another methyl donor, L-methionine. And that's something you would need to take care of if you were doing it the old-fashioned way. Most guys today and gals don't want to put on just bulk. They want to keep it lean mass, and so they do a lot of cardio. They do sets differently. They eat differently, so that they don't build up a fatty liver. But again, anabolic steroids have been known to do that. So you might want to consider your liver while you're doing an anabolic steroid. But again, I'm just trying to make something out of this question because I think most people would agree. And no offense to this gentleman, Quinn Riley, but at 15, this should not be a consideration unless there's something off, which should be evaluated by a doctor. And I just gave you one thing that could be off. The pituitary not functioning. But if you're otherwise healthy and considering taking Anadrol, don't. It's just not worth it based upon not only your protocol, but the fact that you're 15. You don't want to do anything that might affect you negatively in the long term, no matter what the odds are.
Good advice. Thanks, Doc.